Hello, Grace staff. My name is Kelly Donahue. I'm the Health Services Director. Going to be sharing with you a little bit today about some first aid basics, and then Trainer Bob is going to be sharing some CPR and AED training. We're also going to cover some bloodborne pathogen, universal precautions, PPE, things that we have to do each year. Later on, I'm going to be talking a little bit about our medication policy, also RenWeb alerts for students, what that'll look like, our attendance policy, and then some COVID topics as well. So starting with some first aid basics, as a staff member at Grace, we are expecting you to be able to help a little bit with first aid. And this is going to be really brief, but we want you to know what those expectations are, and then also when you should call for help, call the nurse's office, or what your resources are. One of the most important things is just to stay calm in any kind of emergency situation. The more people panic, that can become contagious and can just spread. And so the more you can stay calm, that'll help students or whoever you're helping stay calm as well. And then the second thing is if you can help with crowd control, after kind of that next line of help were to arrive, if you can help just disperse the crowd so that the student or whoever isn't embarrassed, and so that the people that are responding to help can actually get to the individual. Another thing is to assess the scene when you get there to make sure that you as a first responder are safe. So you want to look out for any dangerous things that might be in the area. Locate a cell phone or a landline if possible so that you can call for help. And then communication is really important in these kind of situations. We want to make sure that the information is communicated correctly, who is sick or injured, what's going on, and their location, just to make sure that all that is relayed correctly to the next group of people. Finding the problem. You want to tap the person and shout or ask, are they okay, to see if they're responsive. Check if the person is breathing. Look for signs of injury such as bleeding, broken bones, burns, or bites, and look for medical information, jewelry, so bracelets, necklaces that might say something like type 1 diabetic or someone that has epilepsy. That can be helpful as well. Consent for treatment. So before you provide first aid or any kind of help, it's really best to introduce yourself and to explain who you are and that you're there to help, and also to ask for permission to help. Even though if it's a student, it's kind of an implied consent, but we just want to be courteous in asking for help and explaining who we are. And consent is implied if the person is unconscious, so we're going to assume that they want help, so you can and should help them. When to call for help. So you should ask for help whenever someone is seriously ill or injured. If you're not sure what to do, by all means, call for help. Some examples of someone who might be seriously ill or injured: anyone who does not respond to voice or touch, and you also want to get an AED that we'll talk about later. Anyone that's having chest discomfort, chest pain, also grab an AED. Anyone having signs of stroke, so that's usually like facial weakness or numbness on one side, or extremities as well, trouble speaking, things like that. And also anyone with a breathing problem. And so who should you call? During school hours, we want you to call the nurse's office at extension 860, or you can send someone to come get us, either way. After school, you're going to call Trainer Bob, and when you get here, you'll get a updated emergency contact card that has some important phone numbers, including the nurse's extension and Bob's phone number. If emergency transport is needed and the victim can't be transported safely by private vehicle, call 1669 for an ambulance. We'll talk a little bit more about that later. And then, again, after medical help arrives, please help with crowd control. And then just a quick note about what happens when you do call 1669 for an ambulance. It may take up to 60 minutes for an ambulance to arrive, and so a lot of times we will just send someone in a private vehicle. We have some emergency drivers that have volunteered to help with that. But we also need to be specific about what we want. Just calling 1669 doesn't mean they'll automatically send the truck or the supplies that we need, so we want to be specific to tell them what's going on and what they'll need to bring. Where we send people, this is just a list of a few of the hospitals that have a full trauma emergency room, so we tend to send students or individuals there first, but there are several others in the city. And then a quick note about bloodborne pathogens. So these are diseases that can be spread through blood or bodily fluids, things like HIV/AIDS, hepatitis B, and hepatitis C. And as potentially a first responder, we just want to make sure that you are protected, again, so that you don't become a patient or get sick or injured as a responder. And so the best things that you can do are to practice universal precautions. And that starts with good hand washing or sanitizing before helping someone, wearing personal protective equipment that we'll talk about in a little bit, covering wounds, removing gloves without touching the outside of the glove with your bare hand, so trying to slide underneath the clean part, disposing of waste, especially things like bloody gauze in a plastic bag, and then cleaning any potentially contaminated surfaces with a bleach solution of 1 to 10 bleach and water. And you can call elementary or secondary office, and they will call facilities to help you clean that up in your classroom. And then again, about universal precautions, you legally cannot ask a child if they have HIV, and so we just want to assume that anyone and everyone has it, and so just to protect yourself every time, also just so that becomes a habit for you. Personal protective equipment includes things like gloves, goggles, face shields, masks, and gowns. We have some real basic first aid kits in both the elementary office and secondary office that have some of those things, and then also we have those supplies in the nurse's office as well. But another thing just to help protect yourself is ask the student to do as much of kind of the care as they can based on their age. So I'll talk about later, like if they get a bloody nose, can you hand them paper towels and they can pinch it themselves instead of you having to hold it for them and potentially exposing yourself, at least until you can get a pair of gloves on or something, and then you can help out.
All right, so I'm going to talk to you a little bit about CPR, and CPR is one of those skills that you've probably trained in before, or you've heard somebody talk to you about before, and it's one of those things you hope that you never have to use, but should you ever need it, you'll be glad that you took this refresher course. So with CPR, as Kelly said earlier, the first thing to do is always make sure that the scene is safe. So when you come upon a possible victim or a potential victim, the first thing you're going to do is always survey the scene and make sure that there's nothing there that could cause you personal injury. So we're going to look for downed power lines, we're going to look for standing water, snakes and other critters that could cause problems. Traffic is a big concern also. So once you've surveyed the scene and made sure that it's safe, the next thing you're going to do is check the victim to see if they're responsive. The worst thing you could do is come up to somebody taking a nap and start CPR on them and they were just trying to get a siesta. So we're going to come up and say, hey, are you okay? Are you okay? Okay, the victim's not responsive. So now I'm going to say help, and I'm going to call for help. Okay, help. Call 1669 or 911 if you're in the US. It's always important that you assign somebody that task. So I'd point at somebody and say, hey, you go call 1669, or hey, you, in this context at Grace International School, hey, go get the nurse. Be specific. If you know the person's name, call them by name and tell them to go get the nurse or to go get the athletic trainer, which is me, after school. All right, so send them to go get help. The next thing that you're going to do is you're going to look, listen, and feel for signs of life for no longer than 10 seconds. Some of the new literature says that you're not going to spend any time searching for a pulse, because even trained professionals can miss a pulse sometimes, but it's good practice still to make sure that there's no pulse and no breathing. And so the easiest way to do that is to get down and to look, listen, and feel. So you'll put your cheek down to see if they're breathing. You can look at their chest to see if it's rising and falling for breathing. And you're going to check a pulse with 2 fingers. Okay, it's important that you use these 2 fingers to check the pulse, because your thumb has its own pulse and can give you a false positive for a pulse. So what you determine from that little evaluation in 5 to 10 seconds is going to determine what happens next, right? So if you determine that during that evaluation they're not breathing and they have no pulse, you're going to start CPR. If you're trained in CPR and you have a certification card through the American Heart Association or the Red Cross or whatever other organization, you are welcome to give breaths, but for the purposes of school here, we're just going to teach hands-only CPR. So that you don't have to worry about putting your mouth on students or other staff members if that's a hang up for you. So for hands-only CPR, compressions are the most important thing in the CPR process. The only thing more important than that is to get the AED as soon as possible. All right, and we'll talk about AEDs here in just a second. okay? So to begin CPR, I'm going to find my hand placement, okay? So I'm going to have an imaginary line drawn between the nipples, and I'm going to go right into the center of the chest on the breastbone or the sternum. I'm going to put the palm of my hand on that sternum. I'm going to put the palm of my other hand on top of that, the first hand, and then I'm going to put my body weight over the victim, and I'm going to compress down. Okay, I'm going to compress down at 2 to 2.5 inches for compression depth for an adult, and I'm going to compress at a rate of 100 to 120 beats per minute. All right, so it's pretty fast. In the past, we've used staying alive as the beat count for that, but it's actually a little faster than that. Okay, the main thing to consider also, or one of the main things to consider also with compressions, is you want to make sure that you come completely off the chest between each compression to allow the heart to refill with blood so that you can circulate that blood effectively. If you just maintain pressure on the chest when you give compressions, it doesn't allow that to refill and you're not giving effective CPR, all right? So to demonstrate that, I'm gonna draw that imaginary line, hand in the middle of the chest bone, weight over the victim, and I'm going to compress quickly, all right? So 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13. If I'm giving breaths, I'm going to go to 30, and then I'm going to give 2 breaths. So it's a ratio of 30 compressions and 2 breaths. If I'm doing hands-only CPR, I'm just going to continue to give compressions until the situation changes, which means they either start to be responsive or more advanced medical personnel arrive. Okay, so our nurses are going to be pretty fast, I think, to arrive on a scene. I'm going to be as fast as I can to arrive on a scene, and then after that, the ambulance, if we do need to call one, it varies in length of time. Like Kelly was saying, it can take a half an hour or it can take an hour, and it's never a sure thing what's going to show up. Okay, so this is very important. As you are beginning CPR, it's important for you to know where the AEDs are at Grace. AEDs are the most effective way to save someone's life who is in an emergency like this. We have actually 4 on campus. We have 1 at the nurse's office. I almost pointed, but you guys don't know where I am. So 1 at the nurse's office. There's 1 out at the training room out by the athletic office. On the fields, on the soccer fields. There's 1 in the secondary office on the wall, and then there's 1 in the elementary as well. So we're very blessed to have 4 here. Most schools don't have any, and some only have 1, but we have 4. So it's important that you know where those are, okay? So in that scenario where I was walking you through, making sure the scene is safe, are you okay? Are you okay? Checking the victim for responsiveness and signs of life, calling for help. You would also send somebody at that point to go to get the AED, all right? And it would be really good if you're in a position where you can tell them where that is. Because if you just tell a student, go get the AED, they might not know where that is. So if you can say, go to the secondary office and get the AED, that really would be helpful, all right? As soon as the AED arrives, there's a few things that you need to know about the AED, okay? They look like this here on campus. So if when the AED comes, this is what you're going to be looking at. The most important thing that you need to remember for an AED is to turn it on. So once you do that, the AED is actually going to talk you through all the next steps. So if you don't remember anything I'm saying right now, remember to turn on the AED, all right? And you can do that. There's this big green sign that says pull. So we just pull that off.
Begin by removing all clothing from the patient. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
Okay, so I'm not going to do all of those things because our mannequins aren't equipped to handle this.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner.
Okay, so as you can see, the AED will tell you everything that you need to know, okay? If you look at the pictures of the pads, it shows pad placement. The pad placement is always the upper right part of the chest and the lower left. That's to ensure that the current from the shock actually goes through the heart where it's supposed to. But if you forget that, again, there's a picture you can see. And it doesn't matter which one of these pads you put in which position, so long as one is in one spot and the other one is in the other. All right, so that's for an adult victim or for like a high school age student, okay, after puberty. All right, for a child over in the elementary, we actually have child pads. All right, these are they're used exactly the same, except for one pad is placed on the front of the chest and one is placed behind the back between the shoulder blades. And again, there's a picture of that here, okay? If you happen to be doing CPR on a child, heaven forbid, and you need to use the AED and you happen to open it and you see that it's an adult pad and you see that these are there, these are very easy to switch out. All you have to do is there's a little switch on the bottom of the AED. You just pull this and it'll pop this whole cartridge out. you pop the new one in, and then proceed like you've been taught to, all right? These are very, very important to be used as soon as possible to increase success of CPR, all right? There's a few contraindications for using an AED. One would be a pacemaker. So if you remove the victim's clothes like the AED told you to, and you see that there's a raised bump on the chest, that's most likely a pacemaker. That would be a contraindication. But if you're in doubt, the best thing to do is always to use the AED, all right? The person's already unresponsive, they're already clinically dead, you're not gonna cause any more harm, and their best chance of survival is to use the AED as soon as possible. So if you see that, that's one thing. Another contraindication is body jewelry. So if they have any body jewelry, I know there's a lot of there's a lot of crazed teachers with a lot of body jewelry, maybe, I don't know. But those all have to come off. All right, so if you're talking about earrings and things, those are fine. Nose rings are fine. Lip rings are okay. Anything from the neck down has to come off, so the torso, all right? So if you see those things, remove those before you shock. Otherwise, the electricity will go to those bits of jewelry and cause other problems, all right? I've got stories about that you can ask me later. Also, another contraindication would be standing water. So if a victim is in grass that's wet, that's okay, but if they're in a puddle with standing water, the shock will dissipate through the water and it won't be effective. So you need to move them to a drier spot. So other than that though, AEDs are good to use. You should also never use one on an infant. If you find yourself having to give CPR to an infant, you would not use an AED in that case. You would just provide compressions, which is with 2 fingers, until more advanced help arrived. Right? So that's a quick rundown of basic CPR for adults and children. The one thing I didn't mention before is if you come upon a child that needs CPR and you're a bigger person, it might not be necessary for you to use both hands to get the necessary depth of compression, which for a child would be 2 inches, 1.5 inches to 2 inches. So you'd use one hand instead of 2, but the hand placement's the same. Imaginary line across the nipples, center of the chest, one hand up over the body, and you're going to compress. Okay, again, same rate, 100 to 120 beats per minute. All right, thank you very much.
Thank you.
Thank you.
Okay, now we're going to talk about some potential medical emergencies. Again, hopefully these are things that you'll never need to use, but we just want you to be prepared. And so some general breathing problems to be aware of if someone is breathing really fast or really slow, they're having trouble with each breath, any kind of noisy abnormal breathing, if they can only make sounds or speak no more than a few words at a time, kind of pausing to catch their breath in between words. And also, it's good to know that panic attacks and asthma attacks can look really similar. Feel free, you would send both of those people to see us at the nurse's office, and we can kind of help differentiate what's going on. You can also help them use their rescue inhaler if they have one. We'll talk about that a little bit later on with the medication policy. And then call for help either if they don't have an inhaler or if the inhaler doesn't help their breathing after a few minutes. The Heimlich maneuver, so this is used on people when they're choking if they're not able to clear any air. So if they're coughing, let them try to cough it up, but if they're not able to move any air at all, you would stand behind the person choking, wrap your arms around their waist, make a fist with one hand slightly above the person's belly button or navel, grab your fist with your other hand, and then push hard and up kind of into the abdomen as if you're trying to lift the person up. And you can do that 6 to 10 times or until the object hopefully is expelled, dislodged. If it were not to be successful and if they were to become unresponsive, then you would begin CPR like Trainer Bob just showed you, and hopefully the compressions would again be able to expel the item. What to do if someone throws up in class or anywhere on campus. Kids can vomit for a lot of reasons, and so it's not necessarily always contagious, but we want to err on the side of caution. So you'll send them to us, in the nurse's office. We want you to send the rest of the students out of the classroom, call either elementary or the secondary office so they can call facilities to come clean up your class and then bring the rest of the class in, just so it doesn't become a domino effect of other students feeling sick. Seizures. So people with seizures sometimes get an aura. That's things like a change in vision, a headache, a strange smell before they seize, and it's just a warning sign that they might seize soon. If you teach a student with seizures, you will get an action plan with more details. We don't have any students currently that are have seizures or are on an action plan, but you would be aware of that. Also just know there are different kinds of seizures. Not all involve kind of the classic convulsions that you think of. There are some more mild ones, but we would let you know, again, what to look for if you were teaching a student with that. But generally you want to assist an individual who's having an aura or is having a seizure to the floor and position them on their side. You want to protect their head from injury, so if possible, place something soft and flat like a towel under the head and clear the area around them of any harmful, sharp objects. You'd give us a call in the nurse's office and have the rest of the students either turn away or clear the room if possible, because it can be pretty scary. One really important thing, if possible, is to time how long the seizing and the shaking lasts. That's really helpful just to be able to compare if they've had seizures before, if this one is longer or shorter, and just lets us know kind of what's going on. You do not want to restrain them at all or insert anything into their mouth. They used to teach to do like a bite block, but that is no longer recommended. Just know that they might also be incontinent of bowel and bladder, and so just something to be aware of so that they're not embarrassed in front of other students. And also it's very normal for them to feel lethargic or groggy after having a seizure, and so if they don't wake up right away and are super responsive, that's pretty normal. It kind of takes them a while to wake back up. Do not give any food or drink during or immediately after a seizure. And be sensitive about what is said during or after a seizure. Some people can hear and remember what's being said, so we just want to be sensitive to that. Fainting. Fainting can look scary at times. Sometimes it can look like a seizure just in the way people fall or if they hit something on the way down. But the basics are just to stay calm like everything else. Make sure that they're breathing. Give us a call in the nurse's office and provide some privacy so they're not embarrassed. Most of the times this is just due to dehydration or someone locking their knees. Allergic reaction. So people can be allergic to many things, including different types of food like eggs, nuts, and shellfish, or stings from bees or wasps. If possible, take out the stinger if you can, otherwise we can do that. And second, so a little bit about kind of our medication policy. Secondary students are allowed to keep their EpiPens with them. Elementary students, we keep their EpiPens in the nurse's office, so just know that's where those are at. Just know also that some students use an inhaler during an allergic reaction. So they might not have asthma, but they might get wheezing or similar breathing problems during an allergic reaction. So they might have both an EpiPen and an inhaler. And you will also get an action plan if you are teaching a student with a life-threatening allergy. So just know that would be coming. Some signs and symptoms of anaphylaxis. So this is a really bad allergic reaction that is life-threatening. If they have hives or a rash, it may or may not be itchy. Swollen lips or tongue, trouble breathing, a racing heart, dizziness or fainting, and nausea or vomiting. And then I want to talk through real quick how to use an EpiPen or epinephrine pen. It can be injected through clothing, so you don't need to remove any clothing before giving it. They typically come in a clear tube, so you want to remove it from the carrier tube. Pull off the blue safety cap that's on the top. I kind of think of blue like the sky, so the blue part goes up. And then the orange tip here is going to go on the outside of the thigh. And real quick, by the way, it tells you on the side of this is a training device, but both these and the real ones have all the instructions written right there. So if you forget, know that they're there. It's also really important that you hold it kind of making a fist like this. You don't want to hold it like this because some people have accidentally gotten it mixed up upside down and then injected the medicine into their thumb, which is not good to have in your fingers and toes. So you're going to hold it like this, and then you're going to place it on the outside, kind of the middle of their thigh, and push until you hear a click sound like that, and then wait 3 seconds and then let go. And the needle is enclosed, so you'll never see the needle. If they're afraid of needles, that's okay. And if they're not improving in 5 minutes, you can repeat the process. Most students have a dual pack of 2 EpiPens, so we'd be getting the other one or backup ready for them just in case they need that. Diabetic emergencies. So we do have a few diabetic students on campus. Again, if you are teaching one of these students, you'll be notified, you'll get some extra training and get an action plan, but it's just good for everyone to know that if you were to meet one of the diabetic students and they're having one of these signs or symptoms, that they go to the nurse's office right away. They kind of get a fast pass to come see us anytime they need to. So obviously unconsciousness, seizure, confusion or unusual behavior, fast breathing, nausea or vomiting, shakiness, and again, anytime they request. There's kind of two extremes of emergencies with diabetics. Their blood sugar can either go too low or too high. Generally, too low happens quicker than going too high, and so they might just need something to eat or drink, but we can help them with that. So send them to us, and please either walk with them or send another student with them. Don't let them go by themselves just in case they feel worse on their way. Okay, moving on to some injury emergencies. Bleeding. Most bleeding will stop with pressure. If the injured person is able to help you, ask them to put direct pressure on the wound while you're putting on your PPE, putting on gloves. Apply pressure over the gauze bandage, and then you want to add more gauze as needed. Never take off the old gauze, because if it was starting to form a scab, then you're pulling it off and it's kind of having to start over. If anyone bleeds through more than one Band-Aid, send them to see us. We'll just take a look and make sure they don't need stitches. And then most small cuts can be cleaned with soap and water, so feel free to send students to the bathroom to clean that up. And then those first aid kits in both elementary and secondary offices also have Band-Aids and basic supplies like that. Nosebleeds can often bleed a lot. You want to have them pinch their nose really tight. Do not have them tilt their head back because, one, we can't see if their nose is still bleeding, how much it's bleeding, and also they're swallowing it, and sometimes people throw up from that. And so we want them to tilt their head forward, pinch their nose. You can send them to the nurse's office. They usually don't bleed for more than about 10 minutes, but feel free to send them to us and then give your office a call, and they'll call facilities to clean up any blood in the classroom. Possible broken bones. You never want to move a victim that is suspected to have a head or neck injury unless it's necessary to provide emergency care. Sprains and suspected broken bones should be splinted by a nurse or trainer. Head injuries and suspected concussions. Anyone with these signs or symptoms should be referred to medical personnel right away. Things like dizziness, nausea, vomiting, confusion, amnesia, severe headache, mood swings, unequal pupil dilation, and loss of consciousness. The research is constantly changing on this, and so Bob and I we keep up to date on what's recommended, but we do want to take head injuries seriously, especially if they're back to back. And so even if it seems like a small head injury or they're just having a headache but not the other symptoms, err on the side of sending them to us and we'll evaluate them and kind of go from there. Environmental emergencies, so heat-related illness. Yeah, obviously it's very warm, very hot here in Thailand, and so we want to just be careful about preventing things like heat cramps, heat exhaustion, and heat stroke. Heat cramps and exhaustion are a little bit more of the more mild ones. They can still have muscle cramps, nausea, vomiting, but the difference with heat stroke is that people's level of consciousness can change. They can act confused, and their skin can be hot and dry instead of hot and like sweaty. And so that's a serious emergency. So we would call 1669 or get them to a hospital as soon as possible. And all of these people would be resting, cooling them off, safely but quickly. Air quality, we'll talk about more as it gets closer to that season, but just know that our policy, including a chart, are available on the staff portal all the time. And I recommend you buy a mask early if you're not already using one for COVID. Our attendance policy related to illness. So this applies both for students and staff. Should stay home for fever, a temperature over 100 degrees Fahrenheit or 38 Celsius. Both students and staff should be fever-free for 24 hours without the use of medication, so without ibuprofen, paracetamol, Tylenol, before coming back to school. We just want to make sure that those medications aren't masking something more serious going on that could be contagious. Cough or runny nose. Again, right now, just with COVID going on, we want that person to be seen just to make sure it's not contagious, and also to make sure that they're getting the help they need for whatever else might be causing it if it's not contagious. Sore throat, especially with headache and fever or swollen glands in the neck. We're worried about strep throat, and students with strep throat can return to school after they've been on antibiotics for 24 hours. Eye drainage and redness. Again, we're worried about conjunctivitis or pink eye with that, and so we just want to find out if it's bacterial or viral that might be contagious. So they need to be on antibiotic eye drops for 24 hours before coming back to school. Any kind of rash, including definitely chickenpox, needs to stay home until all the pox are scabbed over. Diarrhea, 3 or more in a 24-hour period, or 48 hours for norovirus. Vomiting 2 or more times within 24 hours, and they should wait until the vomiting has stopped for at least 24 hours. And then lice or scabies need to be treated before they can come back to school. Late arrivals, we just ask that students, and it would be great for staff too, to check in with us in the nurse's office when they come back to school before returning to class, just so we can know what's going on, make sure they're feeling better, and then send them on their way. If a student gets sick or injured at school, send them to the nurse's office with a note and a buddy if needed, and you can just write what's going on that. We'll help them out and then make a return note, what we've done for them. Our policy is that they can rest in our office for up to 20 minutes, and then at that point, we're either sending them back to the classroom or we would be contacting parents about coming to pick them up, and we would also let you know if that was the case and get their supplies. Our medication policy is that we keep all medicine for elementary students in the nurse's office. So again, that's pills, that's EpiPens, rescue inhalers, lunchtime medication, all kept in the nurse's office. Secondary students are only allowed to keep rescue inhalers, epinephrine auto-injectors, and diabetic supplies. So lunchtime medication, any other as-needed medication, we keep in the nurse's office, and parents and a physician need to sign a paper that students are competent to use that. RunWeb is our electronic system for both education and the nurse's office. And so we've added alert pop-ups for teachers if you have a student with life-threatening allergies, asthma, diabetes, seizures, or ADHD for secondary. If you're in elementary, the Ed support team will let you know a different way about them. Some of them you can mark as red, and so it'll go away. Others are really important, and we want you to just be reminded of it every time you log in. So just know there's 2 options with that. And then you do have access to kind of some further medical information. There's a tab on the right-hand side called Medical that you can see more information, but we just ask that you would use discretion with that just to protect their privacy. Just look at students that you're teaching that's relevant for you to know about. Emergency preparedness, so you should have a student list on a clipboard in your classroom ready to go in case of a drill or emergency. You'd evacuate to the designated area, and then just know that we have a nurse in each of the 3 areas responding with a first aid kit in case anyone needs it. If you're planning a field trip, please let us know in advance so we can print some paperwork for you and also make a first aid kit. And then some quick COVID policies. Just a reminder that the reason we take all these precautions is that we really want to care for each other and at the same time honor our TIE authorities. And so they've given us like 44 regulations that we're following. We want to respect their authority with that. And just remember that there are always going to be people with more and less risk tolerance than you, and so we want to be gracious throughout this process. Like we just talked about, it's really important that you or a student, anyone who's not feeling well, stays home, and let us know right away if you start to not feel well during the school day. Most often, COVID is spreading from person to person from that direct contact, so physical distancing and masks are really the most important kind of interventions that we can do. And a few things on masks. We just ask that you model appropriate use and attitude. The students will really pick up on that. And so, if you could encourage and model that, that would be helpful. Teachers are able to replace your mask with a face shield when you're teaching from the front of the room, so you're also physically distancing from the students. You can also remove your mask when working alone or physically distance from others. And some students with one-to-one aides may need to remove their masks, so just know that we've made some exceptions for some students. And all students can remove their masks for lunch and recess, so when they're outside or need to eat or drink. And also with masks, I would just encourage you or students that might be having a hard time to try some different styles. I have some that have multiple layers and are a little bit tighter or thicker, and so you can try some that are thinner or a favorite color or logo or something. We just want to encourage people to find something that works for them. Teachers, we ask that you keep doors open during passing periods for airflow and to prevent students from touching the door handle each time they're coming and going. We ask that you supervise hand sanitizing when students enter the room, and that you supervise sanitizing desks or supplies each time they're used before a different student. So you'll have a spray bottle with 70% alcohol and paper towels to wipe down desks and supplies in between. If you have any questions about our COVID policies, we ask that you check with your supervisor first, just because they kind of know your job, your role, your resources best. But if not, then feel free, either they or you can contact us. Again, our extension is 860, or you can email our group account, nurse@gisthailand.org, and we check that frequently. And I just want to say that we're really blessed to have 3 nurses right now. A lot of schools and districts are struggling that don't have school nurses, and so we have a great team working together on this. Also, real quick, if you are trained in CPR and first aid, we would love for you to be a first responder. Our goal is to have 2 in each building to be able to respond quickly, kind of get there first before even us nurses are able to respond. If you want to be a first responder but are not currently trained in CPR or first aid, let us know and we'll let you know when we might have a class coming up. And if you have had a Thai driver's license for at least 6 months, we would love for you to be an emergency driver if you're interested. So again, let us know. With these roles, we kind of need you to be able to be pulled from the classroom quickly, so teachers might not be able to do this, but check with your supervisor if you're interested or ask us, and yeah, we'll let you know. We are also doing temperature checks in the morning, and so several staff have volunteered for that. When you arrive, we might still have needs for that, so if you're available in the morning from 7:50 to 8:10, let us know. And we'll eventually have you sign our HIV/AIDS policy, and then if you want to practice in person the CPR and EpiPen training that we talked about today, feel free to stop by the nurse's office and we can get those supplies out for you. And with that said, that is all I have. Thank you so much for listening, and we're excited to have you guys back or arrive here on campus soon. Bye.